Everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and today evening we're going to talk about pediatrics. Pediatrics and the subtopic of choice is pediatric cardiology. Hello, hi Osama, what's up? How's everyone doing? So in this segment, we're going to talk about very important regarding the pediatric cardiology. Hello, Ashutosh. Hello, Nishi. Hello, Osama. Hello, Savan. Hello, everyone. So आज की सुंदर शाम शुरुआत करते हैं प्रभु के नाम. And first of all, I would like to congratulate our amazing students who have worked really hard for their FMG exam 2021, and they have worked really hard, and so they deserve this wonderful platform. And now I want your names to be there on the 12th March exams, which is there 2022 of the NEET PG. Okay, so we have this free test calendar medical PG preparation these days. For the newcomers, we have this amazing test which is going to happen every Saturday, and these are the dates you must try to participate as much as possible in these tests. They are totally free, and as much as possible you should participate because that will improve your confidence. And hello Sayani, what's up? For the newcomers, we have something known as what you called in the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription, you get have all the access to my live and recorded classes. You get to study from the best of the best educators all over the India. You get to participate in various live tests and quizzes, and also you can watch me on your iPad, on your Android, on your any device. You can watch me. As far as the iconic subscription is concerned, you get the Unacademy platform, and as well as you get the Prep Ladder subscription also, like your access to the best from two of the best. All the clinical notes, video lectures, question bank, rapid revision, treasure notes, everything you get on the our iconic subscription, right? So that's it. And also for the newcomers, like if you download the Unacademy app, you there is an option of the special class where we make a lot of MCQ polls which will be helpful for you in clearing, in having a better view for the exam. And also you can ask any doubt anytime, and you never miss the classes because every single lecture is recorded on our YouTube channel and also on the Unacademy app. Okay, and also a very important thing, we have already made this beautiful focus FMG 2022 batch and a target NEET PG 2022 batch, which is full, which is for everyone. And if you want to participate, then you are most welcome. And that's it, plus and the iconic subscription. And this is a small code because sometimes the plan is little expensive, and everyone, it's difficult, financially it will be little beneficial for you if you use this code if anytime if you want to take a plan. Okay, so yes, and also before starting our amazing mind-blowing segment, this is like our dear colleague of the study with me pathology test series by Dr. Priyanka Sachdev, and she's one of the very good faculties. You must be studying nicely from her. And so today is 14 January, and today at 9 p.m. tonight, she has her live test session series, which if you participate it will be nice because very wonderfully she has made the question paper, and it will be good. I mean, it will be good for the participation. And it's free of cost, and rank 1, rank 2, rank 3, you'll get 5,000, 3,000, 2,000 rupees Amazon vouchers. All you have to do is use this code because the test will be logged. If you have to unlock the test, use the code Dr. Anand, and that's it. And she's very wonderful. I have seen her lectures also, and she starts with like, am I audible visible, am I audible visible for everyone? Hello everyone, like that she starts, and she teaches okay, chapter number 7. So can we start the wonderful chapter? And before starting any amazing segment, we always have a motivating quote, and today's motivating quote is nothing but, you don't need a new year to make a change. You don't need a new year to make a change. You only need a Monday. You don't need a new year to make a change. Sir, next year pakka I'm starting, sir. Sir, next, sir, that's a Monday, sir, definitely. Sir, once this COVID gets over, sir, I am full planning to join the session, then I will definitely start now. So don't give excuses. You're not giving excuses to me, you're giving excuses to yourself. You're giving excuses to your life, not me. I am studying every day. I'm very good at my job. The question is, are you good at your job? So you don't need a new year to make a change. You only need a Monday. And just imagine today is Monday and start being a change. And how can you make a change? By studying well, by studying amazing. कहते हैं बूंद से सागर बनता है, बूंद बूंद से सागर बनता है. तो आगे क्या होने वाला है ये तो नहीं पता, बट टुडे इफ यू रीड, इफ यू लर्न दिस 1 hour of segment, if you understand properly, you are on the way of your success. So the moral of the story is, you don't need a new year to make a change, only need a Monday. Hello Shubhangi, hello Rachna, hello Sayani, hello everyone. So today's topic of choice is cardiology, and the subtopic is like, this is the part 7, where I'll be talking about very important syndromes, and I'll also be talking about ventricular septal defect. So this was the top priority question of the NEET 2020. Identify the syndrome. Identify the syndrome, and only one hint I'll be giving you is that the child has a supravalvular aortic stenosis. So what do you think if this picture comes, like, what do you think, what this child resembles to which syndrome, what kind of personality, or what are the pupillary findings you are able to appreciate in this picture? Who will tell me? Hello Pooja, nice sunflower. Hello Shubhangi, pancake has not come. Hello Savan brother, है ना, वेरी गुड सावन, कल मिलते हैं सावन, कल आ जाना, ठीक है? यस, आइडेंटिफाई द सिंड्रोम एंड चाइल्ड हैज अ सुप्रावाल्वुलर एओर्टिक स्टेनोसिस. तो एनीवन? यस. सो सारिका रत्ना इज वेरी गुड. द मोस्ट कॉमन कंजेनिटल हार्ट डिजीज, द मोस्ट कॉमन कंजेनिटल हार्ट डिजीज इन विलियम syndrome, the most common congenital heart disease in Williams syndrome is supravalvular aortic stenosis. Now I'll be telling you also about the babies, how the baby looks like of Williams syndrome. Point number one, this one. In the German mythology, in the German mythology, these are like a supernatural being. In the German mythology, these are worshipped in the German mythology as a supernatural being. Okay, these are known as elves. Elves बोलते हैं इनको. ये जो फोटो है, this picture, in this picture we can appreciate a image which is like which is worshipped in German mythology, and it is not like a supernatural being. These are known as elves, and the this face resembles like this face. Okay, see this smile and see this smile, like the eyes and the aura is nothing but, this is nothing but a kind of a Williams syndrome. Number one, supernatural being worshipped in German mythology. It is known as elves. Okay, and very importantly, elf. See, we said elf and the plural is elves. It is a type of a human shaped supernatural being worshipped in German mythology. German mythology. And also I show you one picture, one more beautiful picture. One second. I want to show you one more picture also. This one. This is a very important, very nice image based question. So this picture, see this person smiling like that, and this one, can we have any appreciate the smiling? Is it kind of resemble? Yes or no? सावन की तरह स्माइल कर रहा है ये, है ना? सावन तू भी ऐसे स्माइल करता है. हाँ, so can we see that? Yes or no? This one and this one, is there a resemblance? What do you think? Image based picture is everything in life. Very good. Osama says looks like Avatar. अवतार बहुत अच्छी मूवी थी. हाँ, अवतार जैसा ही लग रहा है. सो जर्मन, कैन वी सी द स्माइल? यस और नो? Yes, Nishi is right. So this one, see, if midnight 2 o'clock also, if I wake you up and ask you what this picture looks like, you will say this looks like a Williams syndrome. Like the smile, the face resembles like a supernatural being. It resembles like a elves. Okay, that you should know. Okay, now coming to the little details about the Williams syndrome. So here, so the most common congenital heart disease in Williams syndrome is supravalvular aortic stenosis, right? Supravalvular aortic stenosis. Every single word which is coming from my mouth is a PG entrance question, so you must participate and must attend. So the most common congenital heart disease in Williams syndrome is supravalvular aortic stenosis. Second question, which is the most common congenital heart disease in Turner syndrome? Anyone? Sayani, Savan? Yes, Savan is my dear junior who is a supernatural, who has a supernatural power. Okay, huh. So the most common congenital heart in Turner syndrome, yes, the most common congenital heart in Turner syndrome is bicuspid aortic wall, bicuspid aortic wall, and most common cause of death in Turner syndrome is coarctation of aorta. Okay, see, now these are 6-7 MCQs PG entrance question. Let's finish them. The most common congenital heart in Williams syndrome is supravalvular aortic stenosis. The most common congenital heart in Turner syndrome is bicuspid aortic valve, and most common cause of death in Turner is coarctation of aorta. And Which is the most common congenital heart in Noonan syndrome? The most common congenital heart in Noonan syndrome is pulmonary stenosis. Everyone knows that the most common congenital heart in Noonan syndrome is pulmonary stenosis. And now, very importantly, this one, Ashutosh, yes, Dye-George syndrome. The most common congenital heart in Dye-George, I'll tell you in the further slides. In the further slides, we'll be looking at the child of Dye-George syndrome, and then I'll tell you which congenital heart is important in that. Okay, so Williams syndrome, Turner syndrome, and Noonan syndrome is finished. I assume that in after this slide, you know these three PG entrance question, the most common congenital hearts in William, Turner, and Noonan. Next point. Yes, please read the line with me. I want the best of the best positive intention in this class. Have a smile, relax your mind. It's just like a chit chat session, and we are covering a very beautiful topic of cardiology, and the subtopic is our cardiology part 9, where we're going to talk about few syndromes. Elfin faces. Elfin faces is the form of faces where the patient present with facial characteristics bearing some similarity to those traditionally associated with elves. Same, the supernatural being in German mythology, and the comparison with that, the syndromic baby looks like a elfin faces. Elfin faces. Okay, yes. I'll give you a chocolate if anyone can tell me what is the finding in this picture. What is the finding do you see in this picture? Nishi Agarwal, Sayani, Shubhangi, Sarika, Osama. Which what is the finding can we appreciate in this picture? Okay, my hint I'll give you is the iris. कि आंखों का रंग कुछ अजीब सा नहीं है. Don't you feel that the color of the eyes is little different? So what is the okay, Nishi says KF ring. Yeah, I agree with you, but KF ring is seen in Wilson disease, but this is not the KF ring. In the KF ring, I would have shown you a better slit lamp examination of the Desmond membrane of cornea. I would have shown you a KF ring, but this is different. This is nothing but known as star burst iris. Star burst iris. Yeah, very good. Who said Savan told the right answer? Starry. Star जैसा इसका आंखों का रंग है. Star burst iris, broad smile, and gregarious personality. Gregarious means outgoing personality. These are the very important highlighting features of Williams syndrome. In this today's class, we are studying something new which we have not read in the previous classes. So today's topic of choice is Williams syndrome. Most common congenital heart is supravalvular aortic stenosis. It was a NEET PG question. NEET PG 2020 question was there. How does the iris look like? Star burst iris, broad smile. This one, see, can we see that? This one, a very 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 beautiful picture. ये लग रहा है सावन की तरह. सावन ऐसे हंसता है. So yes, so this is nothing but this, like a broad smile, like a broad smile. Starry burst iris, starry burst iris, broad smile. Yes, very good. And gregarious personality. Gregarious matlab outgoing personality. ठीक है, very good. So let's link and study. I always have this very bad habit of linking and study. So starburst iris is seen in what you called Williams syndrome. Where do you see brush field spots in iris? Brush field spots, कहीं गलती से भगवान के लिए नाम सुना है? Brush field spots in iris is seen in which condition? Which condition? See, three irises I'll ask you. Let's see if you can answer. Dr. Ashutosh, Savan, Hanji, Surgeon of East. बताएं Hanji, Sayani बताओ जल्दी. Very good. Exactly. Have you heard brush field spots in iris? कहीं पढ़ा है गलती से? हजार बार पढ़ा हुआ है. It is seen in Down syndrome. In the Down syndrome, you see brush field spots in iris. Very important PG entrance question. So starburst iris you see in Williams syndrome. Brush field spots in iris you will see in Down syndrome. कोई बात नहीं सावन, Down syndrome मिलता है. Down in the down, if you're a newcomer, Down syndrome 2 hours 120 minutes of class we have taken on Down syndrome. If you're a newcomer, once you finish this session, you go to the Unacademy app, download it, and just write Anand Bhatia, and there my whole videos are there, totally free of cost. Watch them. We have done a beautiful video of Down syndrome. So brush field spots in iris you see in Down syndrome. Okay, where do you see heterochroma iridis? Heterochroma iridis. Three irises I'm asking you. Okay, heterochroma iris. Where do you see that? What is the meaning of heterochroma iris? Sayani, what do you think? Savan, आशुतोष बताओ जल्दी आंसर क्या होगा इसका. Very good, very good. You guys are answering so well. थोड़ा सा और कोशिश करो. Two eyes are there. पास कम two eyes are there, okay, and heterochroma iris, the change in the color of the lens, the change in the one is red and one is, yeah, different color. Hetero means different, iris means the colored part of the eye. One eye is different and one eye is different. Who will tell me? Anyone? The best answer is हॉर्नर सिंड्रोम. नहीं डियर, आई एम वेरी हैप्पी ओसामा ने ट्राई किया. हॉर्नर सिंड्रोम में तो क्या मिलता है? द निमोनिक वाज पैमेला. In the Horner syndrome, you get ptosis, anhydrosis, meiosis, enophthalmus, loss of ciliospinal reflex, and anisocoria. That you get in Horner syndrome. ये जो अलग अलग रंग की आंखें हैं, रिमेंबर ये कौन है? ये है हॉस्टल का वार्डन. Waardenburg syndrome. In a case of Waardenburg syndrome, you will see heterochroma iris. Heterochroma iris is seen in Waardenburg syndrome. हॉस्टल का वार्डन होता है जिसको रात को दिखता नहीं है. क्यों नहीं दिखता? Because his eyes has a different color. So hostel warden, number one, he has a different color of eye. Number two, he can't hear you. He will have a hearing loss. Number three, hostel ka warden will have a white bunch of hairs. White bunch of hairs over here. Like the whole scalp will not be white, only some white bunch of hair. So this is the triad. This is the triad of Waardenburg syndrome. Please, are you understanding? Yes or no? This is a very important class. Very good. And Cyanese now it's very right. Waardenburg syndrome, the gene mutation is PAX3. PAX3 gene mutation. I'll repeat again. ये बात कहाँ तक पहुँच गई? Number one, what do you see in what kind of iris do you see in Williams syndrome? So star burst, जैसे चांद चमकता रहा हो, या starry iris. Starry iris, you can say that. You can say star burst iris. Yes or no? So star burst iris you can see in Williams syndrome. Then I ask you about the brush field spots. Brush field spots in iris. The answer was Down syndrome. And then I ask you heterochroma iris, change in two colors of the eyes. Then the answer was Waardenburg syndrome. How will I remember, sir, Waardenburg syndrome? Yes. Yes, so Waardenburg syndrome, hostel ka warden. Number one, he will have a change in color of the iris, that is heterochroma iris. Number two, he can't hear you, hostel ka warden, so hearing loss. And number three, he will have a white bunch of hairs, in the front part. This is the triad of Waardenburg syndrome, and the gene mutation is PAX3 gene mutation. ठीक है? Very good. So Robin Khatri says, so good sessions, sir. Thank you, dear. Thank you so much. हाँ जी, मनी समझ में आ गया, ओसामा समझ में आ गया, ठीक है. ओसामा शेख like सुनील नरेन here. अच्छा, ये सुनील नरेन कौन है मुझे नहीं पता. Okay, ठीक है, बढ़िया. और please put a like button if you're able to understand. My only intention in this class is that you should learn best of the best. That's it. हम में, बाकी पानी कम में, ठीक है. और दूसरा, आओगे तो वेलकम, जाओगे तो भीड़ कम. मन में आ गया तो मैंने बता दिया, वरना इसका कोई रिलेशन नहीं है इस सिंड्रोम से. ठीक है. तो विलियम सिंड्रोम कहानी खत्म होती है. ठीक है. एंड वेरी इंपॉर्टेंटली, और क्या पॉइंट्स होंगे विलियम सिंड्रोम के? ओके, लेट मी चेक. ओके, यस. पीजी एंट्रेंस क्वेश्चन नंबर 1. What percentage of children with this disorder? Which disorder? This one. ये क्या है फोटो में? Who will tell me? What is there in the photo? Shubhangi, what is this? Osama Sheikh, my dear brother, what is this photo? Can we see this gregarious personality? Gregarious personality, yes or no? Yes, we can see that. This outgoing broad smile. Can we see a broad smile? So this is the case again of Williams syndrome. So broad smile, gregarious personality. Please remember, yes, what you call the Williams syndrome babies usually have hypercalcemia. Hypercalcemia. So the question is, what percentage of children with this disorder can have hypercalcemia? Anyone? यस, सावन, अच्छा, सायनी, ठीक है, वेरी गुड. लल्लन, सबके आंसर है 10%, 20%, 30%. कोई रह गया तो 40 भी बोल के खत्म करो, अगर सबने अलग अलग ऑप्शंस बोल रही हैं तो. द बेस्ट आंसर इज 30%. 30%. किसने बताया 30%? सायनी पोल, वन ऑफ आर डियर स्टूडेंट, सायनी पॉल. वेरी गुड. तो सायनी पॉल्स को मिलता है बहुत सारा प्यार, बहुत सारी इज्जत और बहुत सारे बेस्ट विशेस. भगवान करें आप जल्दी एक महंगी सी गाड़ी खरीदें, ठीक है, और आप दिल्ली आएँ, फिर मुझे घुमाएं उसमें, ठीक है. सो व्हाट परसेंटेज ऑफ चिल्ड्रन विद दिस डिसऑर्डर हैव हाइपरकैल्सीमिया? प्लीज रिमेंबर, द पेशेंट्स ऑफ आवर विलियम सिंड्रोम यूजुअली हैव 30% chances are there that these baby will have hypercalcemia. Please remember, we have to link and study. There is something known as Dye-George syndrome. Very important exam question. There was something known as Dye-George syndrome. Those syndromes baby will have hypocalcemia. And in the Williams syndrome, the baby will have hypercalcemia. Are you understanding? So this is very important. Okay, remember this, Saini. Okay, we have to link and study. See, always remember, my dear friends, 100% syllabus will never get over. If you are having this dream that first I will finish 100% syllabus, then I will do first revision, then I will do second revision, then I will do third revision, then I will get rank 1. तो मुझसे लिखवा लो, ऐसा नहीं होगा. It's never about finishing 100% syllabus. It is always finishing the very high yield content, very important content. It's too much about revision, 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 and very importantly, smart work. Smart work. There is something known as hard work, there is something known as smart work. There is a student who studies for 8 hours, 11 hours, 14 hours, still gets 0 in marks, and there is a student who studies only for 6, 7, 7 to 8 hours enough and get a distinction, and that person goes to guitar classes, that person goes is very good in badminton, that person has a multiple, talents and hobbies. So which category you want to be? Just doing a hard work or a smart work? What do you think? So I think smart work is important. और कैसे करेंगे स्मार्ट वर्क? भगवान ऊपर से कुछ कोई प्रसाद बांटेगा? नहीं, ऐसा कुछ होने नहीं वाला. अगर सपना देख रहे हो तो स्मार्ट वर्क मीन्स link and study. Like just now I told you, in Williams syndrome the babies will have hypercalcemia. So just suddenly ask yourself that in which syndrome the baby can have hypocalcemia. The answer is Dijot syndrome. ठीक है, समझ में आ गया? यस, आशुतोष समझ में आ गया माय डियर? ओके ब्रदर, आगे बढ़ते हैं. ठीक है. यस, अ वेरी ब्यूटीफुल पिक्चर. इफ एनीवन कैन टेल मी व्हाट इज दिस, व्हाट डू यू कॉल दिस कंडीशन? आई शो यू वन मोर पिक्चर. आई थिंक हैव, या, अ वेरी 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 ब्यूटीफुल पिक्चर. व्हाट डू यू थिंक? व्हाट डू यू थिंक अबाउट दिस? हाँ जी, आशुतोष, साइनी. ओके, साइनी सेज कैच 22. नहीं डियर, ये वाला कैच 22 नहीं है. आई एम हैप्पी यू ट्राइड, आई एम रियली हैप्पी दैट यू ट्राइड, बट डियर दिस इज नॉट कैच 22. Any random guesses? Who will tell me? Okay, I'll give you a hint. The hint is congenital absence of skin. There is a congenital absence of skin. Which syndrome do you see congenital absence of skin? See, always remember, my dear friends, my dear brothers and sisters, that for every syndrome, guys, for every syndrome, the whole book you don't have to read. You have to read the highlighter points, top 10 points, top 20 points, or at least top 7 points of each syndrome. If I say gregarious personality and broad smile, you will think of Williams syndrome. If I say a female with a webbed neck, you will think of, what will you think of? You will think of Turner syndrome. If I say a male with a webbed neck, you will think of Noonan syndrome. Are you understanding? If I say hemi-hypertrophy of limbs, you will think of Beckwith-Wiedemann syndrome. Like that you should answer. मोती की तरह तुम्हें आंसर करना चाहिए, ठीक है? So this is nothing but, हाँ जी, very good. Savan, okay, he's trying cutis aplasia. Number one, cutis aplasia is seen in Turner syndrome, and yes, cutis aplasia, you can say that, but this baby cutis aplasia happens on the scalp, bro, actually not here. So this baby, typical picture, first see the picture. It's a very beautiful picture, guys. This one, can we appreciate congenital absence of skin? So this is nothing but Bart syndrome. Bart syndrome. Cutis aplasia usually we see in the scalp, bro. This is happening in the skin. Okay, cutis aplasia we see a scalp. Scalp may there's a congenital absence of the skin and all, or even a bone also. That is there in cutis aplasia. Cutis aplasia is the point of our what you call Turner syndrome. But this one is a Bart syndrome, congenital localized absence of skin. Only skin, not the bone, only skin. Whereas in cutis aplasia you have congenital absence of skin or even underlying bone also. In the cutis aplasia, you will have congenital absence of skin, but even underlying bone also can be absent in cutis aplasia. Cutis aplasia is one of the finding of Turner, you can say Patau syndrome. Patau syndrome में ज़्यादा मिलता है actually. Cutis aplasia is one of the finding of the what you call Patau syndrome. Okay, yeah, and this one is Bart syndrome. Hanji, very good, Osama Sheikh. Again, Bart syndrome, remember, this part is over. Okay, see, supernatural, I told us supernatural. This in the German mythology, they worship as a supernatural being. Okay, so I have a question for Savan. If any one of you get a supernatural power, any one of you get a supernatural power, which that power will be? Like which supernatural power you think if you get, then that will be amazing? What do you think? Any supernatural, like for example, like Batman, He-Man, you want to fly, want to run fast, or you want to remember fast, which supernatural power you feel if you get, then I mean that will be amazing. What do you think? Hanji, Dr. Savans, Osama, Kalpana, Saini, Faiz, Ibrahim, Farhaz. Okay, so Faiz says, okay, let's say I'm just writing whatever you guys are saying. Number one, you want कि अगर मेरी memory बहुत अच्छी हो जाए. That's nice. हो सकता है, अच्छी बात है. शुभांगी, शुभांगी. Why do you want to be invisible? My spelling is wrong. हाँ जी, डॉक्टर शुभांगी, इनविजिबल क्यों? क्या तुम पहले करोगी क्या? तुम तो बहुत खुराफाती हो फिर. What will you do by being invisible? Tell me. You want to roam the whole world? What do you want to do? Oh, आशुतोष तो another level. It's so funny to talk to you guys. Work without oxygen. अब तुम इसमें क्या उखाड़ लोगे भैया? तुम work without oxygen मतलब what? क्या मतलब तुम हीमैन हो, बैटमैन हो? What is the thought process? Why do you, why do you, if you want to work without oxygen, like you are planning to go to Mars or Pluto or somewhere Mercury, where are you planning to go then? हाँ जी. Okay, Shubhangi is taking Harry Potter vibes. Okay, yeah, that's nice. That's nice. हम भी पहले बहुत ऐसा देखते थे, and he had a blanket and he used to, get invisible. That's true. Osama says again about memory, that he wants a good memory. That's right. Faiz Ibrahim wants to be Mr. India. I agree with you. ठीक है, और कुछ हाँ जी. Good. So these are the supernatural powers you can get. That's very true. And yeah, that's true. Yeah, let's move further then, guys. Remember, very importantly, yeah. So what all points did we cover about the Williams syndrome? The important points on the Williams syndrome are: number one, round face. The patient has a round face, long philtrum, long philtrum with short upturned nose. Long philtrum. What is philtrum? ये वाला part, ये वाला. This is known as philtrum with short upturned nose. Okay, like a Amsterdam dwarfism. Short upturned nose is known as what you called elfin faces. Okay, but PG entrance question number one: the most common congenital heart in Williams syndrome is supravalvular aortic stenosis. And PG entrance question number two: do you see hypercalcemia or hypocalcemia? The answer is you see hypercalcemia. That's it. Huh. And also remember one very important thing: the second most common congenital heart in Williams syndrome is peripheral pulmonary stenosis. Why am I stressing on this topic? Remember, guys, please, which is the most common congenital heart in Williams? Supravalvular aortic stenosis. The second most common, the second congenital heart disease which can happen in Williams syndrome is peripheral pulmonary stenosis. So, Savan or Sayani, I'll give you a chocolate if you can tell me, like, can anyone tell me any other congenital hearts with the same peripheral pulmonary stenosis? Any other syndrome with peripheral pulmonary stenosis? Sayani, what do you think? Osama, other than Williams syndrome, do we have any other syndrome where the most common congenital heart is pulmonary stenosis? मान जाऊंगा मैं. बहुत ही शानदार और बेहतरीन जवाब देंगे अगर आप लोग इसको बता दें. तो बताओ. यस, ओके. Very good, very good. Batao, anyone? Yes, yes, very good, very good. Perfect. Right. So we have Noonan syndrome. The most common congenital heart in Noonan syndrome is pulmonary stenosis. And very importantly, most common congenital heart in anyone or कोई और syndrome रह गया. The most common congenital heart in Noonan syndrome. The most common congenital heart in Allegili syndrome. Very good. Noonan syndrome and Allegili syndrome. Yes. The most common congenital heart in Noonan syndrome is pulmonary stenosis. Most common congenital heart in Allegili syndrome is again pulmonary stenosis. And most common congenital heart disease in Williams syndrome, like the second most common, I would say, is again peripheral pulmonary stenosis, right? Very good, very good, very good. Yes, this is the good question. Peripheral pulmonary stenosis. This was a NEET super speciality question. Peripheral pulmonary stenosis may be seen in all except. Peripheral pulmonary stenosis may be seen in all except. So, in which congenital heart you don't see peripheral pulmonary stenosis? The answer is very importantly cytomegalovirus. In CMV, you don't see, okay, not in CMV, I would say, I think, yeah, CMV only. So, yeah, exactly. So, peripheral pulmonary stenosis, so D is the best answer. In Williams syndrome, you see pulmonary stenosis. In Allegili syndrome, you see pulmonary stenosis. Even rubella syndrome also, you can see pulmonary stenosis. So, cytomegalovirus is the best answer. Okay, next question. This was Allegili syndrome. Allegili syndrome. Okay, one was our this one. So what all syndrome we covered? We covered Williams syndrome, and this is Alagili syndrome. Can anyone tell me? Anyone tell me any two highlighters of Alagili syndrome? Other than most common congenital heart is pulmonary stenosis, can anyone help me with random any two important points which we have covered in the Alagili syndrome? Yes. Have you read of butterfly shaped vertebra? Butterfly shaped vertebra? Yes or no? Have you read about it? Butterfly shaped vertebra? Yes, very good. Sign is right. Faiz is right. Nishi is right. And yes, yes, Nishi is also very right. Short trunk. Have you heard of short trunk dwarfism in Alagili syndrome? Have we read that upper segment lower segment ratio is decreased in Alagili syndrome? So have we read all these things or not? Yes, yes, we have very well read about these things. Very good. Next question. Yes. Now, who will tell me this? Ashutosh, what do you think, brother? Identify the syndrome. What do you see the picture in this slide? Which syndrome is this? On the Google, everywhere, for this syndrome, there's only one picture seen everywhere all over the media. So this is the picture. Who will tell me? Saini, Sarika, Ratna? Yeah, exactly. So the best answer for this question is George syndrome. George syndrome. So Dr. Savan Singh is very right. Yes, he is very right. So the best example for this syndrome is nothing but our what you call George syndrome. So what happens in George syndrome? The mnemonic is catch 22. The catch 22, right? Very important. And catch 22 में जल्दी से अगर H पे हम आ जाए तो कोई बता सकता है? Yes, hypocalcemia. Yes or no? Hypocalcemia. Yes, very right. That is the one very important point is there. Yes, Osama, it is a George syndrome. What are the important findings? The mnemonic is catch 22. C for cardiac abnormalities. A for abnormal faces, and T for thymic aplasia. Very important star mark. It has been an exam question. Okay, so catch 22 is the mnemonic. C for cardiac abnormalities, A for abnormal faces, T for thymic aplasia, and H for very importantly, C for cleft palate and cardiac outflow tract obstructions, and catch 22. H for hypocalcemia due to maldevelopment of parathyroid hormone, and 22q11 deletion chromosome is there. Very, very, very. Can we please put a like button if you're able to understand? Remember, yes, very good, very good. Please put a like button. So this is nothing but very important George syndrome. George syndrome has been, there are three important questions they had asked, which is what happened to the thymus. So the answer is there is thymic hypoplasia. Thymic hypoplasia. This one question has come in exams. What happened to the serum calcium levels? There is hypocalcemia. 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 Okay. And normally the most common congenital problem in George syndrome you have is cardiac outflow tract defects. There is a cardiac outflow tract defects. So congenital cardiac abnormalities, abnormal faces, thymic aplasia, cleft palate, cardiac outflow tract defects, hypocalcemia, and 22q11. Yeah. Hmm. Okay, Pragya. So faces like abnormal faces, usually I'll tell you, dear, okay, let me, abnormal faces you're asking this one. So what can you see? The abnormal face, see, abnormal faces. चलो जी पहले हंस लो पहले तो सावन से गाय लुक्स लाइक तैमूर ओके तुम तेरी तरह नहीं लगता मुझे तैमूर से ज़्यादा तेरी तेरी शक्ल ज़्यादा लगती है मुझे इस पे तैमूर हाँ मुझे भी तैमूर बचपन में ऐसा दिखता होगा अब तो तैमूर की मुझे लेटेस्ट फोटो तो नहीं पता लेकिन बचपन में थोड़ा ऐसा ही दिखता था हाँ जी सो एब सी डियर व्हाट यू कॉल्ड हु आस्क्ड प्रज्ञा प्रज्ञा abnormal faces or if I say coarse faces means some basic problems on the face. For example, in this face, can we appreciate a low set ears? Yes or no? Low set ears. What is low set ears? Low set ear. If I draw a straight line from the inner canthus to outer canthus, if I draw a straight line from the medial canthus to the lateral canthus and like that, normally my ear lobule should touch that line. Normally my ear lobule should touch that line. Previously, we used to say that two-third and one-third. One-third of the ear should stay above and two-third of the ear should stay down. If I draw a straight line from the inner canthus to outer canthus and like that, that straight line. So now the latest book says draw a straight line from inner canthus to outer canthus like that. If it touches the ear lobule, that line, if it touches the ear, means it is normal. And if it is not touching your ear or it is below that, like below that line, your ear is there, that is known as low set ears. So low set ears, depressed nasal bridge. Can we appreciate a depressed nasal bridge? Yes or no? Yes, like that's what little, yeah, exactly. So like a smooth filtrum, right? So like these are nothing but known as the what do you call it? Kahan gaya? Oh, exactly. These are the faces. These are the faces. In the book, in the Nelson, they have not mentioned much detail about that face. And also not in this picture, but the other picture, the baby can also have a cleft palate. They can also have a cleft palate. So cleft palate, low set ears, depressed nasal bridge, a smooth filtrum or a long filtrum, these all findings are there on the core spaces. But more important is our that only thymic aplasia, hypocalcemia, the deletion chromosome is 22q11, and the most common congenital heart is cardiac outflow tract obstruction. एंटी मोंगोलॉइड स्लैंट लग तो रहा है इसमें, देखने में तो एंटी मोंगोलॉइड स्लैंट लग रहा है साइनी. व्हाट इज एंटी मोंगोलॉइड स्लैंट? डाउनवर्ड स्लांटिंग ऑफ eyeballs. One is upward. The girls do makeup two types. One is little eyes above like that, okay, upward slanting of eyeballs, and one is downward like that, downward slanting of the eyeballs. So one is known as mongoloid slant, and one is known as anti mongoloid slant. So mongoloid slant is upward slanting of eyeballs seen in Down syndrome. Whereas anti-mongoloid slant, where do you see? You see in Treacher Collin syndrome. You can see in Cry-du-Chart syndrome, and also some cases of Noonan syndrome. Also, you can see a downward slanting of eyeballs. In this case, actually, what you called अपना साइनी, that it is seen, but book में mention नहीं है. Book में they have not mentioned that the anti-mongoloid slant you see in Die George, so we will not comment about it. Treacher Collin they have told, Cry-du chart they have told, Noonan syndrome they have told, है ना सारिका? Okay, okay प्रज्ञा, आगे बढ़ें. Very good. And yeah, exactly. And that only about yeah, you can say that. See, I have written extra point. So yes, anti-mongoloid slant you can see, but remember one thing more about this cardiac outflow tract obstruction. No, the most common you see this conotruncal abnormalities in the congenital heart disease. You will see in the Dijor syndrome conotruncal abnormalities, and the most common is truncus arteriosus. The most common. Please put a extra point that anti-mongoloid slant and also conotruncal abnormalities, and the most common is truncus arteriosus. ठीक है, डन. आगे बढ़ते हैं. ओके, यस, कितना टाइम हो गया अभी? हमने क्लास कब शुरू? 5:15. ठीक है, अभी 15 मिनट है हमारे पास. तो again, remember this. So we're gonna start the next topic, that is VSD, ventricular septal defect. Like top 10 important points on VSD. That's it. We're gonna cover that. And before that, again, we have this beautiful quote which says that miracles start to happen when you give as much energy to your dreams as you do to your fears. Miracles start to happen when you give as much energy to your dreams as you do to your fears. तो क्लियर होगा कि नहीं होगा? एम आई दैट मच कैपेबल और नॉट? अरे टाइम नहीं है मेरे पास, आई डोंट थिंक सो आई कैन डू इट, अभी तो बहुत देर हो गई है, अभी तो बहुत जल्दी है, अकेला कैसे करूँगा, कोई और साथ होता, आई विश आई हैड अ रूममेट, आई विश आई हैड अ स्टडी पार्टनर. So many doubts we have. Okay, but dream is only one. So give your best shot. That's it. Don't think so. Okay. कितना अच्छा बनाया मैंने ये. ओके, सो वीएसडी, वेंट्रिकुलर सेप्टल डिफेक्ट. हाँ जी, साइनी ने पहले आप छक्का मार दिया. नंबर वन, वीएसडी इज अ लेफ्ट टू राइट शंट. कैन वी रिवाइज, लाइक सी इट्स अ स्मॉल 5 मिनट सेशन. वीएसडी, कैन वी टॉक अबाउट 10 इंपॉर्टेंट पॉइंट्स ऑन वीएसडी जो हम पढ़ चुके हैं? नंबर वन, साइनी टोल्ड दैट वीएसडी इट इज अ लेफ्ट टू राइट शंट. इफ आई ड्रॉ अ पिक्चर ऑफ 4 ventricles like that, and we have a right atrium, right ventricle, left atrium, left ventricle, and this is our pulmonary artery, and this is our aorta, right? So my question is like VSD, ventricular septal defect, VSD, right? So number one, what all options do we know? Yes, so number one, it is a left to right shunt, yes or no? For the newcomers, please remember that ventricular septal defect is a left to right shunt. Means once the defect is open, the blood will jump from left to right. Why? Because the left side of the heart has a higher pressure and a higher musculature. So left side of the heart has a higher pressure and a higher musculature. That is why the blood will shunt, or the blood will jump from left to right. That is the first point. Second important point is it a cyanotic congenital heart or a acyanotic congenital heart? Anyone? Very good. Faiz, Shubhangi, Hanji, very good. So someone is jumping with other answers. So it is a acyanotic. It is a acyanotic congenital heart disease because all the blood which is going from the left to right and then it is going to the pulmonary artery, and pulmonary artery is connected to the lungs for the purification. So this purified blood or wherever the blood is going to the lungs for the purification, that congenital heart disease will be less cyanotic or acyanotic. Okay, that is a first another point. Okay, very good. So let's move further. So before again in the VSD also, I got this quote. The distance between your dreams and reality is called as action. So I have a dream that I have to buy something, and the reality is I have nothing. But what is the thing left is the action. So do the action. Automatically dreams will come. So in the ventricular septal defect, number one, yes, yeah, this is a very good question. Which is the most common congenital heart disease in cardiology? Who will tell me? Which is the most common congenital heart disease in full cardiology? The answer is ventricular septal defect. Ventricular septal defect is the most common congenital heart disease in cardiology. Which is the most common acyanotic congenital heart disease in cardiology? Anyone? Which is the most common acyanotic congenital heart in cardiology? The answer is again VSD. These all are exam questions. Most common congenital heart disease in full cardiovascular system. The answer is ventricular septal defect. The most common acyanotic congenital heart disease. The answer is, what is the answer? The answer is again ventricular septal defect. And which is the most common cyanotic congenital heart disease? Anyone? Which is the most common cyanotic congenital heart disease? Yes, the most common cyanotic congenital heart disease at day one of life is a TGA. At day one of life is a TGA. What is TGA? Transposition of great arteries. And in the later period, which is the most common congenital heart cyanotic one, the answer is tetralogy of Fallot. The answer is tetralogy of Fallot. Understood? So these are the important points which you need to understand. Okay, regarding this one. Very good, very good, perfect. आगे बढ़ते हैं. Yeah, and so the most common congenital heart disease in cardiology is VSD. The most common congenital heart disease affected by infective endocarditis. Very good. I remember in the previous class I told you, as our what you called, this is our foreheart and this is our VSD, and here is the pulmonary artery. So when more and more pulmonary blood flow will be there because of VSD, there is more and more increased pulmonary blood flow. So more blood flow will be there. The patient will have more upper respiratory tract infection, more lower respiratory tract infection. Whenever too much of blood will go to the lungs, the patient will again come with cough and cold, URTI, LRTI. And also because of all these conditions, the patient can get infective endocarditis. So it's an exam question. The most common congenital heart disease affected by infective endocarditis is VSD. And anyhow, I told you in the previous class, वैसे तो पीडीए होना चाहिए because PDA is much closer to the this PDA is much closer to the pulmonary artery, but PDA doesn't happen in every child. It does not happen in every child, right? It happens in preterms baby. Patent ductus arteriosus सब में नहीं खुला होता, right? That's why the most common congenital heart disease affected by infective endocarditis is a ventricular septal defect. Very good. What are the various types of ventricular septal defect? At least two types you should know. One is membranous and one is muscular. There are two types of ventricular septal defect. I'll show you the picture. One is membranous, this one. The perimembranous type of the VSD, 80%. This part, this one, if you can see this arrow, this one. So this one is the very importantly our perimembranous. And second most common is the muscular, muscle, the problem in the muscle. So there's 2 points you should must understand. The most common type, there are various types of types happen in ventricular septal defect, but the perimembranous one is the most common, 80%. And then we have the muscular septal defect, problem in the muscle. Okay, who will tell me which is the most commonest type of ASD? What were the various types of ASD? Can anyone remember? Anyone? Nishi, Kalpana, Saini, Osama, Sarika, Sweta, Lina, Lallan, and so many more. Exactly. Very good. The most common type of atrial septal defect is the ostium secundum. Ostium secundum type of ASD. There are various type of atrial septal defect. In the yesterday's class only we have covered. We have ostium primum, we have ostium secundum, we have coronary sinus type of ASD, and there are many types of, exactly, there are many types of atrial septal defect, but the ostium secundum one is the most common. Now coming to VSD, there is one perimembranous type of VSD, muscular type of VSD, and other types also. Just remember two types. Perimembranous is 80% common, and the muscle problem in the muscular septal defect, that is second most common. Okay, that you should know. Okay, so what happens in the, what you call the mitral? Yeah, what happens in the mitral area? Where's the mitral area? Yes. So this is our mitral wall. This is our mitral wall. So whenever there is a ventricle septal defect, so see, now this is the end of the class. Okay. So now we have covered multiple points on the ventricular septal defect. It is a left to right shunt. It is a acyanotic congenital heart. It is the one of the important acyanotic congenital heart in cardiology, right? Now, most importantly, coming to the inside pathology of the mitral wall. If someone asks you what happens in mitral wall in a case of what you called ventricular septal defect, there will be delayed diastolic. There will be delayed diastolic murmur. There will be a delayed diastole in a case of, mitral wall, in a case of ventricular septal defect, because same reason, the blood basically, the more and more, because the VSD, the blood is going from left to right, and then from right ventricle to the pulmonary artery. For pulmonary, from pulmonary artery, where does the blood go? It goes to the lungs for the purification, and then blood goes from the pulmonary veins into the left atrium, and then into the left ventricle. So more and more VSD means more and more blood entering into the left atrium, and more blood entering into the left ventricle. So please remember, there will be a delayed diastolic murmur. The diastole, one is systole, one is diastole. So exactly. तो डायस्टोलिक मर्मर, वेरी गुड, डिलेड डायस्टोलिक, बिकॉज जहां भी बहुत सारा ब्लड एंटर होने लग जाएगा, विच एवर कंडीशन मोर एंड मोर ब्लड इज एंटरिंग, that wall takes more time to close. So delayed diastole. Okay, systole is contraction, diastole is relaxation. Too much of blood entering, there will be delayed diastolic murmur. So in a case of VSD, there will be delayed diastolic murmur. And you remember one thing I told you very importantly, in a case of ASD, atrial septal defect, there was a delayed diastolic murmur in the tricuspid wall. In a case of atrial, very important, this is a very important slide. So in a case of atrial septal defect, there was a delayed diastole in the tricuspid wall, because too much of blood, the blood was coming from superior vena cava to right atrium, and also from the left atrium to right atrium. So the diastole, there will be delayed diastole. Okay, diastolic murmur will be, there will be delayed diastole, because too much of blood is there, that's why. So in case of ASD, there will be delayed diastolic murmur in tricuspid wall. In a case of VSD, there will be delayed diastolic murmur in the mitral wall. There will be delayed diastolic murmur in the mitral wall. These 2 points are very important. जहां ब्लड बहुत ज़्यादा होगा, तो वो वेंट्रिकल या वो एट्रिया जो है एकदम से सिस्टोल नहीं मारेगा, वो डिलेड डायस्टोल करेगा, क्योंकि ब्लड बहुत डिलेड एम्प्टी हो रहा है, ब्लड टाइम ले रहा है नेक्स्ट एरिया, वेंट्रिकल या नेक्स्ट एरिया में जाने को, ठीक है. That is the first point. Second important point is, yes, very importantly, in the what you call, this was about the S1. See, they always in exam they ask you what happens in S1, what happens in S2. S1 is because of closure of the tricuspid wall and mitral wall, and S2 or the second heart sound is because of closure of the pulmonary walls and aortic walls. So the first heart sound, I already told you, there will be a delayed diastolic murmur in the mitral wall in a case of ventricular septal defect. Okay, समझ में आ गई इतनी कहानी? Very good, exactly. Yes, Savan brother, you're right. As far as S2 is concerned, what happens in a case of VSD? What happens in S2? In the S2, there will be wide variable split. Wide variable split. What is the meaning of wide variable split of S2? Same story. Normally, what happens? A2 closes early than the P2. Normally, aortic wall closes early than the pulmonary wall. Why? Because lot of blood has to enter from the, normally lot of blood enter from the superior vena cava and inferior vena cava and to the right atrium, then right ventricle, means right side of the heart has lot of work to do. So aorta closes early, A2 closes early than P2. Normally A2 closes early than P2. Now again, in a case of ventricular septal defect, lot of blood is going from the left ventricle to the right ventricle, yes or no? lot of blood is going from the left ventricle to the right ventricle and then to the pulmonary artery. So again the P2 closing is again more delayed. Very good. So this is known as wide variable split. Wide variable, it varies. Wide variable split of the S2. Now the A2 is closing more early than P2, right? Because of the VSD component, because of the blood going from left to right, and now P2 is again getting delayed in closure. So that's it. That is known as wide variable split. So what all did we cover? In a case of VSD, you have to tell about S1 and S2. In a case of S1, the first heart sound, mitral, at the mitral area, I'm able to appreciate a delayed diastolic murmur. In the case of ASD, at the tricuspid area, I was appreciating a delayed diastolic murmur at a tricuspid area in the ASD. But here in VSD, I will have a, at the mitral area, I'll be having a delayed diastolic murmur, number one. And then what are the other points? Yeah, exactly. So yeah, and just remember that you will the shunt murmur in this case will be a pansystolic murmur. It will be a pansystolic murmur, and always remember, like delayed diastolic murmur you will only say when the QP/QS ratio is more than 2:1. Just remember this thing. Will not go too much in detail. Pulmonary and systemic ratio, when it is more than 2:1, then only the symptoms will come. Then only the murmur sound will come. So in mitral area, where you're getting a delayed diastolic murmur because of VSD, but the QP/QS ratio, the pulmonary is to systemic ratio, should be more than 2:1. Should be more than 2:1. Exactly. Yes, Tavan, you are right. This is one extra point, just write in your notes. QP/QS ratio. ASD में भी same था. For the surgical treatment for ASD, atrial septal defect, in the last class which we have done, the QP/QS ratio should be more than 2:1. And here same again in VSD also. That you should know. Okay, what are the chambers enlarged in VSD? Anyone? See, it's some simple maths, okay? There's nothing great about this. What all chambers will enlarge in VSD? When the blood will go from left ventricle to right ventricle to the pulmonary artery, and then the blood is going towards the lungs, and again so much of blood is entering into the left atrium. Too much of blood is, the whole pressure here is happening on left atrium. So number one, the patient, will he have a right left atrial enlargement? Yes. Will it have a left ventricle enlargement? Yes. So these two enlargement are very importantly. Yes, you can say that even some part of the right ventricle also gets enlarged, but mainly left atrium and left ventricle. Left atrium and left ventricle. The book says that left atria and left ventricle, that is what is more commonly enlarged. And what? How do you differentiate like about ASD and VSD enlargement? I told you in the atrial septal defect, left atrium is not enlarged in the atrial septal defect, because whatever the blood is coming is directly shunting to the right atrium. So are you understanding? So you can get a right atrial enlargement or a right ventricle enlargement, but you will not see a left atrial enlargement, right? In a case of atrial septal defect. So in the case of ventricle septal defect, already I told you left atrium and left ventricle. You will see left atrial hypertrophy in a case of VSD, but you will not see left atrial hypertrophy in a case of VSD. This is a very crucial point. This is the exam question, star mark. दिस इज द एग्जाम क्वेश्चन. एएसडी में लेफ्ट एट्रिया एनलार्ज नहीं होता, और वीएसडी में लेफ्ट एट्रिया भी एनलार्ज होता है और लेफ्ट वेंट्रिकल भी एनलार्ज होता है. ये एग्जाम का पता होना चाहिए, ठीक है. ईसीजी में क्या मिलेगा? विल यू सी अ राइट एक्सिस डेविएशन और विल यू सी अ लेफ्ट एक्सिस डेविएशन? व्हाट विल यू सी? देयर इज समथिंग नोन एज राइट axis deviation and something known as left axis deviation. Whichever side of the area gets enlarged, ECG will automatically show that side deviation. So here our left atrium and left ventricle is predominantly getting enlarged, so you will have a left axis deviation. Left axis deviation, left atrial hypertrophy and left ventricle hypertrophy. Yes, exactly, Osama Sheikh is right. Left axis deviation, left atrial hypertrophy, left ventricle hypertrophy. That you should know. ठीक है. Okay, very, this is the again another exam question. अगर मुझे, if a newborn baby, see the most common congenital heart disease in cardiology is the VSD. The child will have a plethoric lung fields, yes or no? Will the child will have plethoric lung fields? क्या होता है? What is plethoric lung fields? Plethoric lung fields is increased pulmonary blood flow. Yes or no? Will the child have increased pulmonary blood flow? Yes, the child will have. Why? Because normally the blood coming from the superior vena cava to right atrium to right ventricle to pulmonary artery, but now in VSD the blood from the left side is again jumping to the right side, so more and more blood is going to the pulmonary artery. That is known as increased pulmonary blood flow, and that is known as plethoric lung field. Plethoric lung field, yeah, exactly, someone is right, more blood will go to the lungs. So that baby, will that baby will have URTI and LRTI? Yes, of course, that baby will have more and more URTI, more upper respiratory tract infection, more lower respiratory tract infection. And later, what happened to this drama? What happens when too much of blood, too much of blood, when too much of blood, when there is increased pulmonary blood flow, what happens later? Later pulmonary atresia happens. Yes or no? जब एक जगह से बहुत ज्यादा ब्लड जाने शुरू हो जाता है, धीरे धीरे वो जगह बंद हो जाती है। देखो, सोचने वाली बात है, एप्स्टीन एनॉमली में क्या था? रिमेंबर एप्स्टीन एनॉमली, देयर वाज अ डाउनवर्ड डिस्प्लेसमेंट ऑफ ट्राइकस्पिड वॉल in the, remember, do you remember this? In the Epstein anomaly there was a downward displacement. This was the normal tricuspid wall, but there is a downward displacement of the tricuspid wall. Number two, right ventricle. This right ventricle was not having that much pressure to push the blood into the pulmonary artery. तब क्या होता है उसके बाद? what happens next? Slowly pulmonary artery starts going to close. That is known as pulmonary atresia. Yes or no? So if the blood will not go also properly to the pulmonary artery starting getting to close, when more and more blood what you call goes to the pulmonary artery, then again the pulmonary artery slowly start getting to having pulmonary atresia, or later it will lead to pulmonary stenosis, and later it will lead to pulmonary artery hypertension, and that nothing but lead to CCF, congestive cardiac failure. So and that is how the patient will start showing you symptoms. When the pulmonary artery धीरे धीरे बंद होने लगता है, then the patient will come to you with issues, then the patient will come to you with some problems. So here the problem means the symptoms. So when a VSD patient becomes symptomatic, when does a VSD patient becomes symptomatic? The answer is roughly around 6 weeks, 1.5 mahina, 6 to 10 weeks, the patient will come with the features of congestive cardiac failure. Same, that periorbital swelling, facial puffiness, JVP raise, tender hepatomegaly, all those things. So when does a VSD patient become symptomatic? The answer is 6 to 10 weeks, by 1.5 months. Yes, and yes, Savan is very right. The shunt which was left to right, VSD is a left to right shunt, but shunt which was a left to right, slowly because of what you call pulmonary, I would say, what you called when there is increased pulmonary blood flow, what happens? There is pulmonary atresia, and that will lead to pulmonary stenosis, that will lead to pulmonary artery hypertension, and that will lead to reversal of shunt. That will lead to reversal of shunt, because pulmonary stenosis ho gaya na, this pulmonary artery is totally closed now that will lead to reversal of the shunt. The shunt which was left to right becomes right to left, and that is known as Eisenmenger syndrome. That is known as Eisenmenger syndrome. Reversal of shunt is known as Eisenmenger syndrome. Okay, and that can happen. So that's what. And what are the clinical features the patient will have? Of course, when too much of blood goes towards the lung, will the patient have dyspnea? Yes, the patient will have dyspnea. Okay, yeah, very good. Then will the patient will have palpitation? Yes, the patient will have palpitation. Will the patient will have increase URTI and increase LRTI? अब एक बार समझ में आ जाता है ना, once you get the concept in your hand, then you'll get it. The patient will have distress, the patient can have cyanosis also, the patient can have increased URTI, increased LRTI, all those things patient can have, or the patient can go into failure, total pulmonary stenosis, and then the features of congestive cardiac failure, exactly, sort of shortness of breath, pneumonia I would say, yeah, lot of pneumonia, yes, that's very true. No, a lot of upper respiratory tract infection, lower respiratory tract infection, because when too much of blood goes toward the lungs, there will be lung issues like cough, cold, cough, cold, cough, cold, fast breathing, cough, cold, and fast breathing, like that. Okay, and how will you manage this failure? The answer is, for any congestive cardiac failure, the drug of choice for CCF is nothing but Lasix. What is Lasix? Brand name is Lasix, but the drug is फिरोसिमाइड, द ड्रग इज फिरोसिमाइड। ठीक है आशुतोष, समझ में आ रहा है आपको? ठीक है, वेरी गुड डियर, वेरी गुड। सो हाँ जी, वेरी ट्रू। सो हाउ विल यू मैनेज दिस फेलियर? बाय वी कैन यूज डिगॉक्सिन और यू कैन यूज furosemide, very good. Nishi is right. Osama, Savan, surgeon, our Ashutosh and Nishi, very good. एंड व्हेन डू यू वांट टू डू सर्जरी? सर्जरी कब करनी है ऐसे बच्चों की? एनी लार्ज डिफेक्ट है ना, एनी एज विद लार्ज डिफेक्ट्स इन होम सिम्टम्स कैन नॉट पूरी लाइन यहाँ पे है नहीं। जब सिम्टम्स you can't what you called manage the patient clinically, when you are not able to manage the patient clinically, then of course a large defect you will do the surgery. Again इसमें लिखना कुछ नहीं है, don't write this line, generally you should know when you are not able to medically manage a large defect, then you will do the surgery, number one. Number two, very importantly, same, when QP/QS ratio, I told you this is one important indication of surgery. When QP/QS ratio is more than 2 is to 1, when the pulmonary is to systemic ratio is more than 2 is to 1, more than 2 is to 1, the pulmonary is to systemic ratio, that time you will do surgery. And I told you 6 months to 12 months of age with large defect associated with pulmonary hypertension. So roughly by 1 year, 6 months to 1 year. And can anyone tell me ASD patient का surgery कब होना चाहिए? When should a child of ASD get surgical correction done? Who will tell me? Yes. Exactly. Yeah, the digoxin will increase the contractility. Yes, digoxin has a chromotropic, dromotropic, ionotropic, effect on the heart. So when does a atrial septal defect patient should go for surgery? The answer to that question was first birthday. At the first birthday, first year, at the first year of life, an ASD patient should go for surgery. And when does a VSD patient should go for surgery? The answer is 6 months to 12 months. 6 months to 12 months of age, the VSD patient should go for surgery. Very good. Sarika is very right. वेरी गुड। ठीक है, बस खा रहा हूँ मैं। वेरी ट्रू। डन, समझ में आ गया, वेरी गुड। एंड व्हाट आर द कॉम्प्लिकेशन? वो तो हमने 25 बार कर ही रखा है। आइसन मेंगर सिंड्रोम, रिवर्सल ऑफ शंट एंड इन्फेक्टिव एंडोकार्डाइटिस। इन्फेक्टिव एंडोकार्डाइटिस इज अ सेपरेट 1 hour topic which we'll talk about the what you call various criteria which you do for infective endocarditis, blood culture and everything. So just remember Eisen Menger syndrome and yeah, okay. So Eisenmenger syndrome and infective endocarditis are the two important complications of the VS, right? Okay, yeah. Enough. And there's also, remember one thing, there's a special type of muscular VSD also. Like most commonest is this our perimembranous 80%. Then we have the muscular VSD, right? There's a special type of muscular VSD also with multiple defects. And that is very difficult to close surgically. Why this? And this is known as Swiss cheese pattern. Swiss cheese. कौन स्विट्जरलैंड कौन गया हुआ है? Who has been to Switzerland? The Swiss cheese pattern. Can we see that? One small defect here, one big defect here, one side defect here, one over here, one over here, one on the Savan's head, and one here and there. So multiple defects like this pattern, nothing but exactly Swiss cheese pattern we have, which is difficult to close, and that is nothing but just remember one thing, like it's a one special type of muscular VSD is there with multiple defects. Okay, yeah, I think that finishes this half, and yeah, that finishes the whole thing. समझ में आया या नहीं आया? Exactly, for infective endocarditis we use Duke's criteria. And where do you use John's criteria? Where do you use John's criteria, or I would say modified John's criteria? किस में यूज करते हैं, कौन बताएगा? Anyone? एग्जैक्टली हाँ जी, किस में यूज करते हैं दिस जॉन्स क्राइटेरिया? ओके, दैट विल बी अ होमवर्क, दैट विल बी अ होमवर्क फॉर एवरीवन। ठीक है, आई होप you have understood. That finishes today's class. Thank you so much for the participation. And this was all about which we need to understand, and about the VSD, and about the important questions regarding VSD. Okay, Rachna, Savan, please put a last like button that you have understood. Rachna, Osama, Ashutosh, Anji, very good, very good. Yes, in rheumatic fever, you're right. Who told the answer? Nidhi, a new name in our hospital, in our group. Rheumatic fever. For rheumatic fever, we use John's criteria. We use John's criteria. Soon in the further cardiology sessions, we'll be talking about rheumatic fever also. And today night we have another class at 8:30 p.m. Today we have a class on PDA, patent ductus arteriosus. Okay, we're gonna cover this congenital heart one by one with important highlighters, important markers. If you want to open the PDA, what will you do? What are the contraindications of giving ibuprofen in a case of PDA, and multiple other questions also gonna cover. Okay, thank you so much for participation in this show. And before leaving, again we have a motivating quote, and only today's motivation. code is be you. Okay, be amazing and be yourself and just be proud. Sometimes I feel that we are working so hard and we are doing so busy we are in our schedule that we forget that get to pat our back, forget to appreciate how much we have done in life, and we have forgotten to appreciate how far we have come in beautiful journey. Working hard is really important, but appreciating yourself that you are working really hard, that also is important, because I think every one of us need a little dose of so I'm very happy for you all that you're so hard in exams, you're attending sessions, doing so much, and not even pediatrics, every single subject you have to work hard so much, and you're doing so good, you're doing really well. So congratulations and be happy. And today, आज रात को पहले 8:30 p.m. session on PDA on this only YouTube channel on the Unacademy platform. And thank you so much, everyone. And bye bye for now. See you after logging and come.